Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Antiplatelet Therapy. Introduction. Your healthcare provider may ask that you take antiplatelets to help prevent harmful blood clots. Antiplatelets are medicines that help prevent blood clots from forming. They are taken by mouth. Antiplatelets are safe and effective when you use them correctly. They can cause certain side effects. Knowing about them can help you know when to call your healthcare provider. This program explains antiplatelet therapy. It covers how antiplatelet medicines work, as well as their risks and benefits. Blood and blood clots. Platelets are small pieces of cells that help your blood clot. Clotting helps you stop bleeding. Platelets create blood clots by clumping or sticking together. Clotting causes the blood near an injury to harden and form a seal. This helps reduce the amount of blood lost from an injury and helps the body heal. Some blood clots can be harmful. A blood clot inside the cardiovascular system can grow larger and block the flow of blood. Blood clots can also move to a narrower blood vessel and block blood flow. Blood clots can lead to the death of body tissue if blood flow to the tissue does not return to normal. This can also lead to a stroke, severe pain, the loss of a limb, or death. Antiplatelet therapy. Antiplatelets are medicines that prevent harmful blood clots from forming. They can also help prevent heart attacks, strokes, and other complications. The number of medicines you take, the way you take them, how well they work, and the length of time they work depend on which medicines you take. Your antiplatelet medicines are taken by mouth. Other antiplatelet medicines are taken through a vein while you are at a healthcare facility. There are several types of antiplatelet medicines that may be used for antiplatelet therapy. Aspirin, or ASA, is a common antiplatelet medicine. Plavix, or clopidogrel, is another common antiplatelet. Plavix helps prevent blood clots in blood vessels and stents. It can also help prevent heart attacks and strokes. Other antiplatelet medicines include Brilinta, or ticagrelor, Effient, or prasugrel. Tell all of your healthcare providers, including your dentist, that you take antiplatelets. Your healthcare provider may ask that you stop taking antiplatelets before certain medical procedures. Carry a card in your wallet or wear a medical alert bracelet that says you take antiplatelets. Tell your healthcare provider that you take antiplatelets before any surgery you may have. You may need to stop taking antiplatelets or change the amount of medicine you take before your procedure. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Risks. Like any medicine, antiplatelets have some risks. By knowing these risks, you can avoid them or catch them early if they happen. People with certain health conditions should not take antiplatelets. Tell your healthcare provider about any health conditions or allergies you may have. You should also tell your healthcare provider if you are pregnant, if you plan to get pregnant, or if you breastfeed. Antiplatelets are not always effective at preventing blood clots and other health problems. The medicines may not work correctly if you do not take your medicine on a regular basis. Do not take the prescribed amount of medicine. Take medicines that affect antiplatelets. Do not stop taking antiplatelets unless your healthcare provider tells you to. Stopping antiplatelets too quickly or too early can lead to blood clots or thrombosis. Thrombosis can lead to chest pain, heart attack and heart failure, stroke, death. For some people, antiplatelets are not effective at preventing blood clots. Some people may become resistant to antiplatelet medicines. This means that the body gets used to the medicine and the medicine does not work like it should. Talk to your healthcare provider about antiplatelet resistance. If you have antiplatelet resistance, you may have to change the kind of medicine you take or the amount you take. You may need regular blood tests and follow-up appointments to make sure your treatment works. When to call your healthcare provider. Possible side effects of antiplatelets include diarrhea, headache, heartburn, stomach pain or nausea, tiredness. Some side effects may go away as your body gets used to taking antiplatelets. Call your healthcare provider if side effects are severe, if they do not go away, or if they prevent you from doing your daily activities. Call your healthcare provider if you have breathing or swallowing problems, chest pain or pressure, dizziness, swelling, hives, or tingling in your face or hands. You should also call your healthcare provider if you have a fever, chills, or sore throat, jaundice, which is the yellowing of the skin or eyes, joint pain, pale skin, vomiting. Seek medical care right away if you have signs of abnormal bleeding. These include blood in your vomit, urine, or stool, black stool, bruising that happens easily, coughing up blood, severe bleeding from a cut. If you are a woman, call your healthcare provider if you have vaginal bleeding that is not normal. If you are a woman who has periods, call your healthcare provider if you have heavier periods than usual while taking antiplatelets. Seek medical care right away if you have a fast or irregular heartbeat, confusion or hallucinations, numbness or weakness on one side of your body, trouble talking, seeing, or keeping your balance. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Your healthcare provider may ask that you take antiplatelets to help prevent harmful blood clots. Antiplatelets are medicines that can help prevent blood clots from forming. They are taken by mouth. There are several types of antiplatelet medicines that may be used for antiplatelet therapy. Aspirin, or ASA, is a common antiplatelet medicine. Plavix or clopidogrel is another common antiplatelet. Plavix helps prevent blood clots in blood vessels and stents. It can also help prevent heart attacks and strokes. Other antiplatelet medicines include Brilinta or ticagrelor, Effient or prasugrel. Like any medicine, antiplatelets have some risks. By knowing these risks, you can avoid them or catch them early if they happen. People with certain health conditions should not take antiplatelets. Tell your healthcare provider about any health conditions or allergies you may have. Some side effects may go away as your body gets used to taking antiplatelets. Call your healthcare provider if side effects are severe, if they do not go away, or if they prevent you from doing your daily activities. Thank you for using Explain.